So
Okay.
it can create some headache sometimes or irritability sa bata. Parang emotional, medyo mahilig mag-whine, especially the first 4, maybe 5 days. It can happen. Although, honestly, very rare yun nangyayari. I have not seen anybody or I haven't seen that all the time. But it can happen.
Mom, Dad, are you worried that your child is easily distracted, unable to sit still, not waiting for their turn, or you get concerns from the teacher? In this video, we will talk about ADHD or attention deficit hyperactivity disorder, which is characterized by being overly active, having trouble paying attention, and having trouble controlling one's impulsive behavior. Mom, Dad, are you concerned that your child is showing some of these signs? Or you get a negative feedback from the teachers? Or your child already has a diagnosis of ADHD and you want to learn more? Well, I'm Dr. Kristine Alba Kiat, and this is Chat with Peds, where I interview experts in the field in order to empower you and give you the confidence to raise happy and healthy kids. Join me as I welcome my guest, Dr. Sheryl Kho. My guest is a friend and colleague, Dr. Sheryl Kho. I've known her for 5 years now. She is a developmental pediatrician and she's a wonderful resource. I ask her a lot of questions about child's development, language, and behavioral problems. And she has helped a lot of kids and families. Help me by welcoming Dr. Sheryl Kho to the show. Hi, She. Welcome back.
Hi, Tin. Hello, good day. Good day sa lahat. Thanks for inviting me again.
Yup. Thank you for coming back. So ADHD, you do get a lot of ADHD patients as well in your clinic.
Yes, of course. That's parang the second
Mm-hmm.
concern. And sometimes it's actually the presenting symptom. So yes, I often do get it.
Mm-hmm. So let's dive in. You know what? I think another hesitancy that parents get is because the ADHD meds has side effects. What common cases do you see in your clinic?
So here in the Philippines, we only have a few ADHD medication.
Mm-hmm.
So ang pinaka-common na lang, I'll just refer, is methylphenidate, no? Yun yung pinaka-first line ADHD treatment. And it's available here in the Philippines. I mentioned earlier na around 80% of the time, it actually really helps the child, which is a good percentage, di ba? The
Yes.
other 20% is because they can have or experience some side effects. Okay, important to understand with ADHD, itong methylphenidate in particular. Syempre lahat naman ng medication may possible side effects, 'di ba? So,
Yes.
ano ang mga possible side effects ng methylphenidate? But also, like I said, it's a temporary medication. So, if they take it today, there's a short-acting one that works for 4 hours only.
Mm-hmm.
So, after 4 hours, wala na yung medicine sa system ng bata. Parang paracetamol lang na every 4 to 6 hours iniinom as needed,
Right.
no? So, yung mga possible side effects ng methylphenidate is sometimes, especially the first few days, kasi nga, ano siya, di ba? It acts on the brain. Ang action ng gamot na to, ang ginagawa niya is pinapa-release pa niya yung front part ng brain ng parang chemicals ng brain natin na important for focusing. So
Okay.
it can create some headache sometimes or irritability sa bata. Parang emotional, medyo mahilig mag-whine, especially the first 4, maybe 5 days. It can happen. Although, honestly, very rare yun nangyayari. I have not seen anybody or I haven't seen that all the time. But it can happen. Usually after mga 1 week, okay na yung bata. Naka-adjust na siya. Nakaka-respond na yung brain niya to the medication. Another possible side effect is abdominal pain. Masakit yung tiyan. Parang hindi sila komportable. Ganon, no? So, to offset that, I advise to take the medicine after breakfast.
Okay.
Okay? So, pero again, lahat ng mga possible side effects ng methylphenidate, actually, they're temporary because like I said, 4 hours lang talaga siya. Hindi siya permanent din kung magkakaroon man ng mga side effects. And if you listen, medyo common siya, di ba? Medyo konting headache, abdominal pain, medyo masakit yung tiyan. Yung iba medyo constipated. Yung iba, uhaw. Ganon, no? So, ina-advise or ina-inform ko yung mga parents na ito yung mga things to watch out for or monitor. Usually, at least matry yung gamot at the very minimum mga 1 week para alam mo kung side effect ba yon, side effect ba yung nakita ko, kasi kung first day lang agad-agad, di ko alam kung pattern ba yon, kasi baka naman pala nagda-diarrhea, meron palang minakain pala talaga, nagkataon, nagsabay. So kailangan talaga minsan bigyan din ng time and i-observe. And ang rule namin to start medication is always to start on a low dose
Okay.
and go slow. So we adjust very, very slowly. Hindi ito weight-based unlike most other pediatric medication, di ba? We check the weight, ganyan. This is not really weight-based, although meron ding targets. Pero, an 8-year-old child may only need a small amount. Tapos
Okay.
minsan yung 13 years old, ganun din yung dosage, katulad ng 8 years old. Kasi conservative dapat yung approach. Yung pinaka bare minimum, kumbaga, na dose, na magbe-better yung bata na maka-function na ng konti. Yan, kahit paano mag-improve. Adjust na lang kasi yung gamot nga na yun, over time, pwede rin talaga mag-change kung nag-growth spurt yung bata.
Okay. So, in the beginning, ma-recommend mo, try lang, let's give it time. Sabihin mo sa parents. Then,
Yes, oo.
monitoring ka muna.
Mag-monitor, oo. So, and then usually they send me message or email to update me kumusta yung performance ng bata. And then of course I advise them, anytime you feel that parang hindi okay yung effect ng gamot or anytime you feel na parang hindi na okay to, stop it. And you
Okay.
can just immediately stop the medication, just not give it. Ganon.
Okay. How about sleep? Side effect din ng ano yun? Ng medication.
So
Affect.
sleep can be affected. Why is that? Kasi depending on yung paano natin, parang meron tayong metabolism ng gamot, paano natin tinutunaw yung gamot or dinadigest ng katawan natin. And also the timing of the medicine. So it's advised that you don't give the medicine close to bedtime,
Okay.
number 1. Kasi para siyang kape, stimulant nga, so parang gising-gising yung bata, na-focus naman siya masyado. So hindi pwede sa gabi. So ina-advise you take this in the morning and sometimes kung kailangan ng 2 times a day na dose after lunch. Ganon. Pero never too close to bedtime. So ako personally, I don't advise to give it past 2 p.m. Pag nakalimutan ibigay today, nakalimutan nyo na ibigay, it's okay.
I
Try
see.
again tomorrow.
I see.
Ganon.
Okay, got it. Thank you. I think those are very useful tips, She. Salamat. So, for parents who want to reach you, how can they reach you?
So I have a Facebook page. They can search Sheryl Kho, .dbp. I'm in St. Luke's, Quezon City. All the other clinics that I go to, yung information nandoon din sa FB page ko. So they can just visit and call the numbers on the page.
Thank you so much for this, She. What a very nice.
Welcome.
Thank you for coming back.
I enjoyed talking about ADHD and our past topics. So looking forward to more.
Yeah.
And thank you so much, Tim.
Thanks. Bye.
Bye.